All right, so we're gonna do 4 tests to determine if it is your hip and what part of your hip is affecting your low back pain. So the first one is a prone hip lift. So you're gonna lay on your stomach. And then what you're gonna do is you're gonna engage your core and your glute. And then the idea is you're just gonna lift the leg where you engage your glute. You're gonna lift it up. Now, you should feel that in the glute. You shouldn't feel it in your low back or your hamstring. If your so some of the red flags are your hamstrings cramp, your low back hurts, or your hip rotates and shifts. So really, the pelvis should stay flat, the glute should stay engaged, and there should be no back pain. This test is called the Thomas test, and that's determining if the hip is involved. So we're looking at the iliopsoas and the rectus fem. So you're going to get your butt on an elevated surface. You're going to grab one leg. You're going to lean back, and then keep your back flat. Now, the thigh should drop, and the knee should bend. So if your thigh is up here, that's a tight iliopsoas, and if your leg is like this, that's a tight rectus fem. And then you get up, and you do the other side. Same idea. Again, the leg should drop and the knee should be bent. Otherwise, if it's up, iliopsoas, and if it's straight, it's actually the rectus fem, and if it's both, then it's the whole hip. The next one is the half kneeling hip extension test. So the idea is you're going to be in a single leg stance. You're going to basically engage your glute on the side you're testing, so the back leg, this leg here. Then what you're going to do is rotate your pelvis down a little bit, and then you're going to lunge forward a little bit. So the idea is you should feel tension in the quad, you should feel like your glute is engaging, and you should feel like your hips are stable. If you can't keep your glute engaged, then that's a red flag. If you get pinching in the back or the hip, that's a red flag. And if you can't hold the posterior pelvic tilt, that's a red flag. And that's for hip stability. Last one is a glute bridge, single-legged. So we're looking for hip stability and making sure the hip doesn't drop. So you're going to bring your feet close into your legs. Then you're going to go up into a glute bridge, keeping your arms straight, engage your core and glutes. And then the idea is you're going to let one leg come up. The hip should be level, so you shouldn't be dropping your hip, as well as your back shouldn't be arched. You shouldn't feel tension in your back. And you should feel the glute of the stabilizing leg. And then you're going to do the other side. And you may find one side is stronger than the other. Same idea. And the big thing is you don't want the pelvis to rotate. So the pelvis should stay level, the glute you should feel burning, and you should be able to keep everything stable. So depending on how the tests go, it's either do you need to stretch your hips, do you need to work on the glutes, or do you need to create some stability, as well as is it actually a true restriction in the low back.